Good morning and happy Saturday, wherever you're watching us from. I'm Dr. Monique Gary, and it is my joy to bring to you today SOS. And if you thought SOS was a cry for help, you're wrong. It stands for Soul Filling Our Sisters. Brought to you by Touch for Life. We're thrilled to bring this segment to you today as we continue our initiative of Black Genes Matters. SOS Saturdays have always been about empowerment. It's been about sisterhood. It's been about the important conversations that fill our spirits and that can fill our homes with knowledge to help improve health equity in our communities. Today's show is no exception. We're talking today about why Black genes matter. We're talking today about hereditary cancer testing, about genomic testing, and knowing your family health history. I have a saying where the secrets we keep are keeping us sick. And today we're going to unlock some mysteries and some truths. And we're going to talk more about how to have these tough conversations because, as you might know, it can be challenging to talk to your family about health. We have historically maybe thought that it's personal and it's private, but we're going to unroof the discussion and we're going to give you some tools and some tips for you to have those discussions with your family members so that we can truly pass down not only generational wealth, but generational health, because generational health is generational wealth. So our first speaker today is Ashley Dedman. Ashley Dedman is no stranger to Touch for Life, and she's a breast health leader. She's a research advocate. She's a published author. She is a previvor, a mover, and a shaker in the world of breast cancer advocacy, and we're welcoming her to the stage at this time. And we also really want to have a robust conversation, and we have a genetic counselor. And let me tell you, I practice breast surgery and I run a high risk program. And finding Black genetic counselors and instructors in genetics are rare. And so we're so pleased to have Kennedy Jones with us today. I'd love for you two to both introduce yourselves a bit more. Tell us a little bit about your why and tell us what you're here to do today with us.
Good morning, Dr. Mo. Good morning, Touch for Life community. Just thank you for the opportunity. Thank you, Laura, for the opportunity to be here. My name is Ashley Dedman, and I have been impacted by 3 generations of breast cancer. Cancer has literally just wreaked havoc in my family, and I really believe that with the power of knowledge and the power of education, I've been that person that can change the trajectory of the impact of this disease for my family and my legacy moving forward. So super excited to be here and be a part of the conversation, talking about the importance of family history, what I've discovered over the generations and the years within my family, and what I'm doing now to move forward to prepare my girls, the next generation, so that they can be better informed and be better advocates for their health. And so I'm super excited to see Kennedy and just to have this conversation with the both of you.
I love that. Welcome, welcome. Kennedy, how you doing? How you feeling?
I'm doing well. Thank you for inviting me here. So, as I was introduced, my name is Kennedy Jones. I am originally from Greensboro, North Carolina, and like Ashley, I have had a family history of cancer on both sides of my family. And it wasn't until really I got to spend time with my family during COVID that I really got to sit down and really talk to my family about our education when it comes to medicine. So I was particularly interested in genetics at a very young age. And then I was introduced to genetic counseling probably in middle to high school, tried to do a lot of science. And then, so eventually I went to undergrad and then I completed my genetic counseling training at the MGH Institute of Health Professions in May of this year, actually. And so now I currently serve as a pediatric and adult genetic counselor at Children's Hospital of New Orleans, here in New Orleans. And I'm also a professor of practice at Tulane University School of Medicine at the Hayward Genetics Center. And my goal in this field is to continue to educate our community on the importance of family education as it pertains to health and genetics, because we do have this history of keeping it private. And I think family conversations and family education, just within like people you trust, and it's usually your family members, that it just takes one person to tell you one thing about their health to make you really realize what you need to do for yourself and the rest of your family and for generations to come.
I love that. And I appreciate you both sharing your why. And I guess I want to start with framing the conversation in a way that most of our families do. You know, my mother, some people know my story. My mother died of ovarian cancer. She's 29. It was a horrible thing in our family that we didn't talk about. And we grew up not wanting to talk about other people's family history and not making this information open. And I wonder if you could share a little bit. And this is a question for both of you about why do you think some of those attitudes have persisted? Why is that our impression? And how do we, so we can tease out how to unpack that? But what are some of the historical reasons, maybe, or just your own personal impressions on why it is that we keep these secrets in our family?
Dr. Mo, I'm reminded by a quote from Desmond Tutu. It says, "There comes a point when we need to stop just pulling people out of the river. We need to go upstream and find out why they're falling in." And I think that is really sets the table for the why. And that really starts with our DNA, our family history. We have the saying, what happens in our home stays in our home. I think that has been said in almost every, Black home, home of color, and I think that's what's killing us. And not to say that some information shouldn't remain in our home. Yes, some things should remain private and within a family. But I believe that when it comes to family health history, it's important that we share that information because it even says in the word, our people perish for lack of knowledge. And so when we don't have that knowledge, we perish. We're not informed. And so I think it's a lot of cultural, but I think too I think it has to do with safeguards that we had to have as a culture with keeping things private and within the immediate family unit. And as we continue to evolve, we need to be able to discern which information we share with other people outside of our address and which information we keep private. But we need to be able to share this information. I know my husband and I have two young girls, and I talked to them very early on about their family history, their great great grandmother, grandmother, and grandmother, and then their grandfather, and then also family history on my husband's side. Um, I also talked to them about my mutation, even much so that I have put my lab results in our will and testament so that if something were to happen to me today at the ages of 3 and 9, they may not remember, but they have that information already in those legal documents because first they're Black young girls, and they're going to be Black girls and Black women navigating through the healthcare system. And we already know what those statistics and that data looks like as far as racism and bias and all the things that they're going to encounter. And so I want to make sure that they have and they're equipped with every bit of knowledge so that when they are navigating through this system, they're armed and prepared to advocate for their health.
Great. Great. Now let me jump to you, Kennedy, and I want to ask you, why is it important? Why is genetic counseling? How does it play a role in helping people understand their risk? Talk to me about what you're seeing in the community and the counseling that goes on.
And so, what I think people don't realize is that, well, to start off, medical literacy in Louisiana is about probably third or fourth grade level. And so, a lot of my job is taking a lot of this big information of what genes are and what chromosomes are and how gets passed down. You get one from mom, one from dad, and how that can be either an autosomal recessive disease. So you have to have them both from both parents to have symptoms of that genetic condition, or if you only have to have one, and how those are passed down. So it's a lot of education that I in myself have to find, do a lot of research, combine a lot of information, and then connect that and try to connect my knowledge to what their family history is and notice patterns, notice who in the family is at most risk, who in the family needs to be tested more than the patient that I'm seeing right now. So I have to combine so much knowledge and to convey that in what is the word, in a digestible manner for people who probably have never ever seen or even talked about genetics in their entire life. And so what I'm seeing now is what people thinks is genetic, or, think that, oh, my everybody in my family has hypertension, but you got to really realize, like, why does everybody have hypertension? Is it their diet? Is it their are they stressed out from, daily life? And things like that. So you have to put a lot of the pieces together, and a lot of it you're not getting, because either the patients don't want to tell you about it, or they just don't know. And I went into pediatric and genetics because of the importance of family education with both pediatric and adult genetic counseling. You see parents, you see grandparents, you see and children. And so you're at least getting the first two generations right there. And then when it pertains to cancer, you're only mostly seeing the patient that is there in front of you. And so when you talk about talking to their families, it can be a big difficult, because then you have to factor in family dynamics.
Oh
And
boy.
who knows how, if you have five sisters and all of them have already been tested, and the one sister who has terminal cancer is the only one that doesn't know, you
Hmm.
know.
So
And
what
so
I'm hearing, oh, sorry, go ahead.
And so what gets difficult is being, we try to let the patient be as autonomous as possible and be as comfortable as possible, but we can't push too hard.
Hmm.
And we can't make them so uncomfortable they don't want to do the testing or find out the information for themselves.
So what I hear you saying though is I hear you saying that there's a lot of education that happens before the counseling can even begin.
Yes.
Right, because you got to teach people why you're asking these questions and what's
Mhm.
important about it, and then try to do so in a way that's respectful and doesn't make anybody feel like they're being probed or isolated or alienated, or any of those things. And I think you're right in that, the health literacy, and it's one of the reasons we're doing this program, is because we want people to have these conversations, before disease happens, and while we're having our family, gatherings and places where it's safe to begin to start to do this health literacy work. And really quickly, before we move to our next segment, what are some of the insights that you've learned gaining from people, and taking their family histories, and what works and what doesn't work? And I'll ask both of you that question, but I'll start with Kennedy. What works and what doesn't, and what have you learned? What are some takeaways?
So a lot of genetic counseling is non-directive. So we make suggestions, we make recommendations, and we try to give a reassurance that if they're not comfortable, it not only is important for them to know, but until they get comfortable sharing that information, it's not that it's not going to get better, but it's not going to benefit who it should benefit. And I think something I'm still trying to learn and get around, because I'm still in my first year of my career, is really showing the importance with a kind of urgency, rather than being as non-directive as we were taught in our programs.
Thank you,
I
Ashley.
would I would say everything Kennedy said, but I think it's also the red flags. What do we look for when we say family history? It's understanding mom and dad's side. What are first and second degree relatives? What are the rare, young, and multiple cancers they should be looking for? I think all of that information is important to know and will help people.
Wow. Well, thank you both for that. I think we're going to have a quick pause, and I want your questions in the chat. I want your comments. What do you want to know about this topic? Because we're going to pivot and talk about some of the research, because we're not only collecting this to help individually families, but how is it helping us as a Black community? Stay tuned. Excellent. All right. Dr. Maya.
Dr. Mo, good to see you again.
Listen, it's good to see you too. We doing this a lot, and I enjoy it every time we chat. It's always, thank you, truly soul filling our sisters. Dr. Maya, I would love for you to introduce to some and reintroduce and remind others of who you are, sis, and what you do in this space.
I am Maya Roberson. I am an assistant professor at University of North Carolina, Chapel Hill in the Department of Health Policy and Management. And I'm also a member of the UNC Lineberger Comprehensive Cancer Center. In addition to that, I am a cancer health equity researcher. I want to make sure that we all thrive. I am a dog mom, an army wife, an aerialist. I contain multitudes, and I'm so glad to be in community with everybody this afternoon to be talking about this critically important topic.
I love it. Thank you so much. And you contain multitudes, and we all contain multitudes. And let's talk about why those multitudes are important and some of the research that you've done and the historic research that highlights the multitudes we contain. Let's start there.
Yeah, I'd like to pick up from Ms. April Martin Higgins' question in the chat, asking about a lot of times we aren't aware of genetic issues until something happens. How do we start the conversation beforehand? And so, as I mentioned, I am both a researcher, but I am a Black woman living in this society. And so, to address this question kind of from my own personal experience and tie this into some of the research, I want to take you back around 20 years ago. I was a little kid on Halloween, quite literally this weekend, and I was trick-or-treating in the neighborhood that was a couple of towns over from where I grew up, where my older sister lived. She was 20 at the time. And I went and knocked on her door where she was living, and my sister had no hair anymore. She was frail. She was gaunt. We had no idea. And I found out as a 10-year-old in that moment that my sister had cancer. She didn't want to bother nobody. She kept it to herself. She was a new mom, scared of the cancer diagnosis. And, that is one of the most salient memories in my mind. And thankfully, close to 20 years later, my sister is still here thriving. But that was kind of my entry point into thinking about family history of cancer. And, I'm obviously not 10 years old anymore. I grew up, and recently, a couple of years ago, I had a conversation with my sister because I realized that I didn't know very much about what had happened to her. I had this salient memory as a kid, but I didn't know what kind of cancer she had, how she found it, particularly as a young adult. And so, to this conversation of how do we start this conversation, I had reached out to my sister and I said, "Hey, I think I remember you having cancer when I was a kid. Can we talk about that? I'm going in for my own annual physical soon. It's helpful information for me to know." And I mean, thankfully, I will acknowledge I have a wonderful relationship with my sister, and we had a great conversation. She told me about what kind of cancer she had, how it was detected, and that was information that I could then be armed with because, as Ashley had just alluded to in the previous segment, I mean, we need to be on the lookout for all cancers in our families, but especially cancers diagnosed in young people, young adults especially. And with my sister being diagnosed at age 20, that was something that was important for me to know as I entered into adulthood. And so, making sure that we are having these conversations because it really permeates across our generations of family. And so that kind of early experience as a kid has led me to the kind of work that I'm doing to make sure that all of our Black families in their multitudes can thrive and have the health information that they need to be able to live healthy and meaningful lives, whatever that means for them.
Wow. So that's your why. And I thank you for sharing it. And it's also so interesting how it has informed the research that you do. There's that saying, we are the ones we've been waiting for, right? And we truly are. And, Michelle, I see your comment in the chat. It is so true. We need to talk about genetic issues, right? As we bring babies into the world, right? The parents need to be as healthy. We learned during COVID, put your mask on first. Can you tell us a little bit about how your research highlights the importance of this family health issue, particularly as it relates to breast cancer in the Black community?
Yeah, sure. So a lot of my research has focused on how Black folks have historically been left out, ethically left out of the conduct of modern cancer research. And this has pretty profound implications. And I really emphasize the ethical piece because we know about the deep, unfortunate racist histories of medical experimentation across the United States among our ancestors. And thankfully, we have evolved past then, but that has had a long legacy of us not being ethically included in the sorts of data that cancer research is generated from. So there's a lot of talk about clinical trials, or the kind of research from which we develop new therapies for cancer, how cancer is treated. There's also genetics sorts of studies that our DNA, our actual makeup, is not being used to determine what causes cancer. How do people develop different types of cancer? So understanding those factors. And so my research is multifold. In some ways, I and partnering with organizations like Touch for Life, because increasingly we realize that the messenger matters, that talking about these issues with folks who look like us, you and I, Dr. Mo, is very different than when the message comes from folks outside of the community. And so thinking about how can we study this sort of message delivery from folks within the community about these important issues. So that's certainly one piece of it. And then another piece of my research as well is thinking about, okay, when we learn about new things that are being developed, particularly in the breast cancer space, new targeted treatments that help folks live longer, that we know will improve outcomes for folks. How are they being deployed across populations? We know that historically, Black women and other folks of color have not been receiving basically the standards of care, of treatment, of where we are. Many folks are still receiving care from 20 to 30 years ago, and our innovations have not caught up to all populations. So part of my work is understanding of where could those particular lever points be in making sure that our advances in cancer, because there have been many, that's what gives me so much hope. How can we make sure that all of our advances of cancer make it to folks who look like us and our families?
Wow. And so, how has the reception been? Are people receptive to this information? Are they wanting to have the conversation about genetic testing and clinical trials? And what's been your experience as you take this to communities?
Yeah, it just coming back to that point, one of the things that's the most grounding for me is when folks say, I've never heard this kind of information from folks who look like us. And I do not take that lightly. That is something that I hold very dearly. We talk kind of in academic speak about trusted messengers and what that means. And, as a faculty member, I hear trusted messengers being referred to as kind of this abstract concept. The trusted messengers are others, and I would really like to posit that we are the trusted messengers, and that we reach folks like through different forms of communication, like Facebook Lives, like webinars, things like that. We need to go where the people are, and that's been the biggest learning experience for me. That in kind of the research world, we publish a lot of research in these journals that you literally have to have an academic institution affiliation to be able to read. But I really love having these sorts of opportunities to work with you, Dr. Mo, and others to bring the science to the people, because I find that when we bring the science to the people where they are, then folks want to learn more. They want to be more engaged. They want to find out more. They don't have to necessarily go to a healthcare facility to find this information. Not saying that that's not important, but when this information can be brought to folks in more neutral settings and where they literally are. I'm sure many of y'all are sitting at home or sitting outside enjoying this beautiful weather wherever you are in the country. That the more that we can get this information to folks where they are by people who quite literally live this. I mean, one of the things that I heard from every single one of us who's talked so far is we all have some kind of family personal connection. These are not abstract research ideas. We did not get into this work because we just thought it was randomly interesting. We get into this work because we live it. And so I have found the reception to be incredibly welcome and great. And I love having these conversations with other Black families.
I love this so much. It really is so fulfilling to hear you say that, because the representation matters, right? Not just from the sort of the optics of things, of having Black faculty and having Black researchers, but it matters in how we receive the information and who the messengers are, right? So we're going to put that, we want to highlight that statement, and we are going to. And I love that you said that, and in the chat, I see you, I hear you when you say, as it stands, we're being compared to research done on 30 to 40-year-old Caucasian males. Dr. Maya, you want to speak to some of the norms, right? The standards of research and sort of how are we shifting that? Has that changed yet? Or is that still the gold standard is the 70-kilogram white male?
Yeah, this is something that I think is changing in no small part because people are demanding that it's changing. We talk a lot in my field of epidemiology and in clinical guidelines too about reference groups and who is that referent group. And Michelle Pointer, you're exactly right that historically the referent group has been young white men, and we know that that's not accurate, and that we are absolutely missing out by not having our referent groups and our inclusion of research include what I say is people of the global majority. Caucasian folks are not the global majority, and that's what the basis of our scientific research has historically been. And so getting energized about participating in research, getting energized about demanding better for our families and our communities, and understanding that we need better source data to be able to reach our communities and have research that is really representative of us. And so thank you all for your engagement, and really appreciate these questions and these insights about where we are in terms of our research.
Dr. Maya, I thank you so much for sharing this with us and reminding us that, we are the trusted messengers and that we need to go where the people are. And I want you to stay on. We're going to bring you back on for some Q&A, but it's a good time to remind you that if you're just joining us, this is S.O.S, Soul Filling Our Sisters on a gorgeous Saturday. And we have some giveaways for you, because to the question in the chat about, where do we have these conversations and how do we do this when a lot of times we aren't aware? How do we start the conversation beforehand? The answer is you start it now. You start it by sharing this message. You start it by clicking reshare on your Facebook pages, your YouTube, sending the link to people, and by getting involved in S.O.S. So we have a giveaway for you. We're going to put it up here. We want you to click the QR code and you can join Touch for Life. You can join and also receive an amazing, amazing giveaway. But we want you to share this message and to start getting the information to disseminate to our families. Because where do we do it? How do we do it, April? We do it by bringing organizations like Touch for Life to your community. We bring it to the cookout, right? And we have the conversation about health, about men's health, while men are doing the tailgate, right? While we're doing our chili cook-off, we're talking about, what's in it and how can we do healthy recipes. There's a way to do health literacy that helps it to make it palatable for our communities, and we can get these conversations started. It doesn't have to be all hot and heavy and contentious, but we can start the conversations that matter, and it starts with you. It starts with you join Touch for Life. We have so many resources. We have a family health questionnaire so that you can begin to go down that questionnaire, and you call Aunt Alice and say, hey, listen, I'm filling out this survey and this questionnaire on health history because I want to know more about our health. Can you give me some details? Can we talk about it? And it's a great way to get started. So as we pivot now to really talking about, this topic of bridging the gap, we've got advocates. We've got people who are doing genetic counseling in the field. We got researchers who are not only pulling up seats at the table, they're creating the table, right? For us to not be on the menu. And so I really want to bring in at this time, I want to bring our panelists in, and I want us all to talk a bit about, what are the education outreach and resources that are available. And so as we bring everybody on, we want your questions again in the chat because we're going to get to those key questions. And I want to introduce also at this time our CEO, and the reason that we're here today, Laura Crandon. Laura Crandon is the CEO and the founder of Touch for Life. Laura, say hey, and I understand you got a special guest with us today.
Hello, everyone. This is such a great session. Thanks for joining us today, talking about something really important. And we have a unicorn on because only 3% of genetic counselors is non-white. And so having Kennedy here and what she's doing in this field is really remarkable. So I applaud that. But sitting next to me, I have the pleasure of sitting next to Shanae Holmes, who is the communications director of Black Jeepers of the DMV. And for those who don't know what DMV stands for, it's the DC, Maryland, and Virginia area. And if you think about working with community partners, that's really why she's here. So we're going to take a second to have Shanae talk to us about why she showed up and is on S.O.S with Touch for Life.
Well, thank you so much, Laura, and thank you, S.O.S, and thank you, Touch for Life, for having me today. Again, my name is Shane Holmes. I serve as the Communications Director for the Black Jeepers of the DMV, and we are a community of Jeepers of color throughout the DC metropolitan area. We're made up of about 1,200 members, and today we're partnering with Touch for Life and Ruby's Kitchen in Bowie, Maryland, for our Convoy for a Cure. We've done this for about 4 years. This is our 4th year, and we tend to get together, enjoy brunch. We're able to make a donation to the breast cancer organization of our choosing, and Touch for Life is receiving that donation this year. And then afterwards, we will convoy throughout the DC, Maryland, and Virginia area for a cure. So you'll see a ton of Jeeps heading down Route 50 with pink bandanas tied on their antennas in solidarity. Thank you again for having me, and yeah, it's a pleasure.
This is incredible. And I want to ask you, how did this initiative start? Because one of the questions in the chat and the recurring theme is, how do we get started? Having conversations about health in community events and other places where health might not be on the program. So tell us just a little bit more about the why behind this and how it was received.
Absolutely. We actually have quite a few members that have been impacted, whether it be themselves or their family members who have been impacted by breast cancer. My grandmother succumbed to breast cancer, quite a few aunts on my father's side as well. So it's definitely a passion of mine to advocate, to spread awareness. And so a couple of us got together some years ago and thought, why not, convoy, get some juice behind it. So we tied some pink bandanas around, and that first year, I think we had about 50 Jeeps come together and ride down the street, and the news picked it up. It just really gained a ton of traction, and we found ourselves partnering with other restaurants with Black owners who are really passionate about the cause. And we found ourselves in the 4th year now, and I heard about you guys on WTOP, and I said, oh, that's a great organization. So I reached out immediately, and thank you so much for accommodating my last-minute request, but everything was phenomenal. But yeah, that's how we got started. It was just a need to kind of push some more information out there and find a fun way of doing it. So we have Jeepers from all over the area. Folks have traveled up from other states as well to participate. So yeah.
That's incredible. We're going to ask you to put your information in the chat because we want people to reach out, and maybe you have a Jeep and maybe you want to get involved, because it sounds like a lot of fun to me. Laura, how's it going over there?
Doesn't it? Oh my gosh, you should see. It's decorated. People have pink on, men and women. It's really fantastic. A group, 1,200 people who have Jeeps, and they picked us to work with. And that's really how it starts. A relationship starts by having some kind of connection to the work. And I'm really grateful for that, to be the beneficiary of the contribution that the Black Jeepers will make to Touch for Life.
Wow. See, this is debunking myths, right?
And I didn't even know about her genetic history, that today we're talking about family health history and breast cancer. And that was something I didn't know, but that's just how the spirit works.
Mm-hmm. Absolutely so. And this is really showing that we show up, right? We show up for us, and that when we make the investment, we are able to provide the resources. We can do the fundraising, but more importantly, we bring the awareness and the information. And I want to ask our panelists here, about those resources. What are some of the resources that are available? I'm going to start with you, Ashley, and then I'm going to go to Kennedy, and we'll close out with Dr. Maya on this question, but that you're aware of. Where do people go for reliable information? Because misinformation about genetics is at an all-time high. So where are the good places to go and the resources?
So first, I kind of bring it back. First, it starts in the home. It starts with, the heads of the homes, the grandmothers, the great-grandmothers. That's where the information starts. Because even when we step outside of the home and we go to organizations like Touch for Life and others, it's like, how do we operationalize that if we don't know our family history from home? So it starts with asking those questions to our elders that are in our family, and really understanding how we're connected. Is Uncle such and such really our uncle, or is he just someone that, we have a lot of adopted uncles and cousins in our family. So I think it's also knowing who is biologically not your family and biologically not your family. Talking about, how persons in our family passed away. And sometimes it's not going to be easy. It might get a little uncomfortable, but we got to get comfortable with being uncomfortable, because this information will help save generations. I think once we know that information, it's going to organizations like Touch for Life. I know two other great platforms are S.O.S, as well as the Bassler Center for BRCA. They have a lot of great information, and those are just a few on family history and genetics. And so I think between Touch for Life and S.O.S and the Bassler Center, those are great. Again, those are just a few great places to start to be able to seek and get information. So again, it's a combination of education within your home and your family, as well as credible information and opportunities and platforms like this.
That's incredible. Thank you so much. Kennedy, would you talk a little bit about the resources that you're aware of and where people can go?
Yes, just to build on Ashley's comments, that it does start in the home. And I think where you can build on that is then it starts with your primary care physician. What a lot of people don't know is that if you already have not, if you don't have a prominent genetic history and you want to know more about it, a lot of the referrals to either genetics, genetic counseling, or genetic oncologists have to come from primary care physicians. And so it's then you take that information and give it to your primary care physician, and they are able to look for those for the next specialist that you need. And so it's being honest, true and honest to your primary care physician, because a lot of it starts where you get your general care. And I haven't been in this work too long, but what I will suggest is looking up your local organizations. Just to build on Ashley again, it also starts from the home of your in the community of your home. And so you just a simple Google search or anything like that, there is most likely a lot of local organizations around you that will also give you and allow you to build on those resources.
Dr. Maya, I want you to weigh in here and talk about sort of how healthcare providers, researchers, and communities can all work together. Are there some successful models of that?
Yeah, thank you so much for that question, Dr. Mo. And one of the things that I want to mention in this conversation as well, just to make sure that this point is emphasized, is that family history of cancer is an independent risk factor for the development of a whole host of cancers above and beyond having a specific genetic mutation. So even if you are someone who never receives genetic testing, or no one in your family has any known mutations, that we are really emphasizing the sharing of this information, or the importance of sharing family health history, because it has a whole host of implications for at what age individuals should start getting screened, for example, for things like breast cancer, colon cancer, or prostate cancer. And so I wanted to make sure that is really emphasized, because I know that we're talking kind of in the weeds about things like genetic testing and genetic counseling and referrals to specialists and things like that. But I wanted to take a moment to take a step back and think about even in that interaction with that primary care provider, and thinking about initiating cancer screening for these cancers that I just mentioned, that knowing who in your family and how the degree of separation they are from you, whether it's a first degree relative, as Ashley had mentioned, your parents, your siblings, or someone a little bit further out. That sort of information is crucial for understanding how folks should be screened for cancers. And so wanted to emphasize that. But I do think that there are a lot of really great models for how these sorts of community partnerships can work. I mean, I would say when we look at folks like Laura, who's really been tearing up the town, and in many ways we've been tearing up the town together. It's I think, quite honestly, we are an example of a really fabulous partnership between a community organization, Touch for Life, myself as a PhD researcher, Dr. Mo as a clinician, to make sure that we kind of come at these topics from all angles. And circling back to, it's intentional that all three of us kind of in that trio are Black women, as I noted before about the Messenger Matters, then making sure that we bring in other experts as well, like folks like Ashley with this deep lived experience, talking about her experience as a previver and genetic genetic counselors like Kennedy to make sure that we round out the expertise. So if you want a model of what these sorts of community engaged partnerships can look like to reach the people, conduct impactful research, and let folks know about this information, I really believe that you're looking at one.
I love that. If you're just joining us, I see folks who are chiming in from as far as Turks and Caicos. Welcome. But this is SOS, a Soul Filling Our Sisters Saturday. We're talking about the family health history and the importance of having the conversations in the home. You see in our ticker, it starts in the home, right? Asking our elders to do better to understand how we're all connected. So what I hear you saying, Ashley and Laura and Maya and Kennedy, is that, we need to find out who's our real cousin, right? Cousin so-and-so and uncle so-and-so, because you know how it is. Everybody's our cousin. How do we, Laura, talk a little bit about some tools, and the last question I see in the chat here, does genetic testing refer only to cancer? And I'm going to start with you, Kennedy, to answer this question. We've got diabetes in our family, the sugar, we got hypertension, we got other things. Talk to us about genetics outside of cancer, just really quickly, because we're going to bring it back to cancer, but this is the health literacy that we need.
A good question, actually. So I do explain this a lot to a lot of my patients, that we have about 20 to 25,000 genes that are associated with genetic conditions. And we can test for about all of them. We don't know everything. So one of our biggest tests, which is called whole exome sequencing, can look at about 20 to 25,000 genes, but it can still miss a lot of things. But we can test for a lot of things, but not everything is genetic. So your family could have a history of hypertension or diabetes and things like that, but we call that multifactorial. So yes, it may run in your family, but it could also be attributed to your lifestyle, your diet, and your environment.
Thank you for that. I think it's an important time to bring up the fact that only 5 to 10% of all cancers are hereditary. And I know it's like, well, wait a minute, y'all just did a whole show on hereditary, on genes and knowing the genes, but there's more to knowing what's in your genes and just understanding that a cancer can get passed down. Those people are at the highest risk for lifetime risk for cancers. But cancer can still be familial. You're still at elevated risk just by virtue of the other risk factors. So knowing your preventable and non-preventable risk factors for cancer are really, really important. Also, understanding the genetics and the genomics. We'll talk a little bit about genomics. It's important because this can impact the treatment that cancer patients get. We're in the era of what's called precision oncology. If you don't know what that is, I encourage you to go to Touch for Life website and look that up, because as we get more precise with how we treat various diseases, including breast cancer, including diseases like diabetes, as we get more precise, we're able to give treatments that are less toxic, right? And that's what we all want, but we need to participate in this research, and we need to talk to your healthcare provider about what runs in your family, and then tease out what's genetic, what should I get tested for, and then look at those lifestyle factors. So again, we're SOS, we're Soul Filling Our Sister Saturdays. It's a good time to remind everybody that we're giving away some good stuff. And if you want to know what that giveaway is, well, you just gonna have to click the QR code. So take your cell phone out. We want you to click on the QR code, and we want you to join the movement. Touch for Life. We got a giveaway. Join this community because it'll prompt you to, one, join our other shows. We talk about nutrition. We talk about yoga, mindfulness, anything that will fill your cup so that you can continue to pour out to others is what we're focused on here on Saturdays, every fourth Saturday on blackdoctor.org with Touch for Life. But if you want to get some good stuff, you got to click the QR code. So we're going to head into really, I think, our last segment here on SOS, Soul Filling Our Sister Saturdays. I know I keep saying it, but it's so catchy. And it's because I want you to share with your sisters so that their souls can be filled too. And I want to talk a little bit about some of these community initiatives. So we get aware, right, Laura? We find out, we're like, oh gosh, there's organizations for this. Oh, there's resources. Okay, I got a tool to help, ask my family these conversations. And I'm even doing things like Ashley said, I'm putting it in my will. Right? I'm passing it down, literally passing this information on. What can people do, and what are some of the initiatives and programs that are working for Touch for Life?
Thank you so much. So what's really important is that we need to go where the people are. I think Dr. Maya said it earlier. And the only way we do that is we show up with community partners who already have the trust of the community. And that is, for example, last week we launched our Black Genes Matter in the community, and our community partner was the National Panhellenic Council. of Prince George's County, also known as the Divine Nine. And that allowed us to have over 150 Black men and women show up on a Thursday night to learn about their genes, genetics, but also have some fun. This message can't go out without working with community partners because we have to meet people where they are, right? We have to really introduce these concepts in a way that's digestible, friendly, it's not threatening, and we get the opportunity to ask experts. Like, you have the opportunity today to ask a geneticist, a breast surgeon, an epidemiologist. We've got an opportunity to ask these questions. But that just means, hey, if you've got an organization and you want to bring this message and this content to them, let us know, because we want to come to you. We want to make sure that we give you the resources. We've got workbooks for collecting your family health history. We've got a tool on the questions to ask your doctor about genetics and genomics in a non-threatening way. We've got resources on what are biomarkers, what are genetics, what does a genetic counselor do? And we break that down in accessible language. As Kennedy mentioned, it's aimed at a third grade reading level because this stuff is complex. And so we want to make sure that it's accessible to you. So we've got those resources, but that's really working with the community to make sure we're bringing it to churches, your conferences, regional conferences, national conferences, where masses of people are, so that we can bring these workshops, whether they're virtual or in person, to the community, because this is information we deserve to know, and we just do not know. No one's telling us, and that is our job, is to get the message out.
Thank you for that. And I want to ask you, Ashley, because as people are watching and thinking, okay, I'm going to go to the website, I'm going to join Touch for Life, but then how do they talk to us about the decision to actually get involved in advocacy? Because you could have found this stuff out and done what you did, and keep it to yourself and in your family. But something clicked in you that said, I got to tell everybody. Like, talk about that transition for people who are wondering how would they get involved and how do they make those transitions into an advocacy space?
That's a great question. I think what really did it for me was, both of my parents were educators. I began my career as an educator. My mom passed away from stage 4 or metastatic breast cancer. And I think it was just having that background of educators. And it really was, this was my responsibility. I didn't want my mother's death to be in vain. And I knew with her being a committed educator, she would have wanted me to take the lessons learned from what we experienced as a family generationally to be able to help others, and especially help our Black and Brown communities. I'm grateful for platforms like Touch for Life. I did not have a Touch for Life as I was coming up back in 2003, 2007 era, where I could find and connect with a community of people who looked like me. I was very blessed and fortunate to have great resources out there that helped me and still help me. But I'm excited about Touch for Life and the platform that they have, because this is an opportunity that even my girls can be a part of and learn from. And that's truly how advocacy starts. It's really understanding that we can't keep this information to ourselves, because it's, when we say generational and we say family, it's not just your immediate family, it's the Black community, it's the Black culture that we're all responsible for. And so it's getting involved, reaching out to Touch, emailing Laura and her team and just saying, how can I get involved? How can I learn more? How can my business or how can my organization support and fund or host events? There's many different forms of advocacy. There's fundraising, there's policy, there's volunteering. And so it's really reaching out to within your community and to organizations like Touch and asking, these are my gifts and talents. What are your needs? What are your assets? And how can we collaborate?
I love that. I mean, it might even just be as simple as pulling up, right? Pull up in your Jeep, right? Advocacy has a lot of forms and fashions, and there's no one wrong way to do it, but you just got to get the right information, right? And you got to know where the people are and target those individuals and then take it to your community. But always start with your why. And it's why one of my first questions to everyone is, what's your why? Why are you doing this? Why are you in this? Because, Dr. Maya, you could just be doing research and working in your silo, But here you are on a Saturday morning, right, filling our souls. And I guess, what's the clarion call for the folks out there who might be social workers and clinicians and doctors and researchers? Why is it important for them to get involved?
Yeah, I would say it's because all of our voices matter. The more stories that we can tell from our own personal experience, that integration of our professional and personal experience, like you've seen throughout this panel today, making sure that our stories are heard to each other, but also to policymakers as well, if that is something that you want to engage with. That was something that Ashley very briefly touched on at the end as well when thinking about advocacy. It's making sure that our voices are heard, for making sure that the new therapies that are being developed are reflective of folks who look like us. It's making sure that we press on our states and on the federal level to make sure that there is adequate insurance coverage for these sorts of genetic tests and genetic counselors like Kennedy, and the sorts of new innovations that are being developed. We all have an important voice in this, for regardless of what your personal or professional role is, to make sure that we hear each other, but also that we are heard more broadly.
I love that because, we're talking about advocacy. And as we wrap up talking about advocacy and legislation and policy, what are the things, Laura, that you and Touch for Life are advocating for? And how can people get involved in the advocacy work and on the legislative side of things?
Thank you. It's so important that our voices are heard. So Touch for Life will launch what's called Behave. And you know us, we like a lot of acronyms. And Behave stands for Breast Health Advocate Voices for Equity, where we will train you how to use your voice, how to tell your story, how to look up legislation, what's the legislative process, how to engage with your legislator at the state level. It's starting at the state level. And this program really grew out of my own experience. I showed up to represent, I was asked to represent my story to support some legislation, and I was asked by a large, well known breast cancer organization. I'm not trying to shade anyone, but I think you'll pick up what I'm putting down. And I started asking questions about the bill because of my background. I've been a health plan executive for, years. And I wanted to ask what the impact of this particular legislation was on the Black community, the people I represent. I had a seat at the table. I'm representing all of you who couldn't necessarily be there, but I was, so I was going to use my voice. And I was dismissed. I was told it was like a shut up and dribble type moment, like, oh, honey, it's all right. It's good for everybody. Just tell your story. Kind of like that feeling. And I came home and said, I never want anyone to feel marginalized and tokenized like that. And that's when I said, I'm going to do something about it. So we started Behave. We're working with our partners, Cardia Services, which is Black founded and women led, to have this whole education. It's a 6-part series to really teach you how to advocate from a legislative perspective. And that launch, we are recruiting people starting November 2nd. You'll be able to apply. There's an interview process, and we will be selecting a cohort of individuals who will go through this process. And we're so excited. We're starting in Maryland, but we'll be coming to other states. I will also lastly say that there's legislation that is before your state legislators. People are on this call from every state. There are only 14 states in the United States that have no cost coverage of genetic and genomic or biomarker testing. 14, okay? Maryland's one of them, Texas is one of them, Nevada, California just signed, New York is in the process of signing. So if you're in New York, you got to contact the governor and say, put that ink to the paper. It already passed the legislature, but we've got a lot of work to do because we've got 36 more states. And that takes you getting educated. We've got a fact sheet that we can provide to you for you to then make a call and say, hey, I need you to support legislation that makes these types of tests no cost. because that's one of the barriers of us getting these tests prescribed for us. So you can, everyone on this call has some kind of representation and can make that phone call and say, we want this legislation passed.
Wow. So a couple things, because I need you, one, to put Behave, the link for that, put it in the chat, even if it's just the Touch for Life website again, because it sounds like to me you're now taking this education and you're actually training individuals on how to do this work. So if you're just joining us, you missed out on a great show, and you can click replay, you can send it, you can share it. But we're talking about S.O.S, Soul Filling Our Sister Saturdays. And we're talking about the Behave program that Touch for Life is sponsoring. They are initiating, where they're teaching you how to have these conversations with your family members. I want to bring out our panelists one last time, because I want to thank you all for your participation today, for your time. And, final thoughts. You got like 30 seconds to give us one good sentence for encouragement for people. What's going to fill their cups? What should they know about family health history? Hit it. Ashley.
Breast cancer aggressively attacked 3 generations of women in my family, but it was genetic testing and counseling that changed the trajectory of my family legacy going forward.
Boom. Wow. Kennedy.
I don't know how I can top that, but family education leads to generational wealth, generational health, and it starts with you.
Fantastic. Dr. Maya.
Let's have these conversations. Our families now and for generations to come will be better for it.
Wow. And Laura, you get the final word, you and our Jeepers in the DMV.
Well, let's spread awareness by any means necessary, even if it's through a Jeep club. Find a way to spread awareness and bring some fun to it.
That's it. Look, Thanksgiving's coming up. Have these conversations.
It's so true. And I just want to shout out the social media handles. You see Ashley Dedmans, Kennedy Jones. If you want to follow her on social media, she's on Twitter at KMJonesGC. That's for genetic counselor. We got Dr. Maya, who is on Insta at Dr. Maya L. Roberson. I'm Dr. Monique Gary on all social media. We need to thank our sponsors, because AstraZeneca, Genentech, Daiichi Sankyo, Gilead, Seagen, High Impact Partners, Foundation Medicine, Vassar. So many great sponsors of this amazing community. And last but not least, this QR code is the one you've been waiting for, because whose genes matter? Your genes matter. Our Black Genes Matters. Join the movement for Black Genes Matters. Click the QR code and join the movement to, 1, bring awareness, 2, bring programs to where you live, where women work, pray, play, and slay, as they say. And we want you to join us next Saturday for S.O.S, Soul Filling Our Sisters, here on blackdoctor.org, 11 a.m. Eastern Time. Thank you for joining us. Click share, and we'll see you next time.